Hand hygiene for 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, hello. I am Nurse Johnson. I'm here to just check up on you and see if anything's wrong. Give me 1 second. And looks like you have a little hard time communicating, especially with the trach in your throat. So do a thumbs up for yes and thumbs down for no, alright? And is your full name John Smith? Alright, a thumbs up, okay, good. And date of birth July 5th, 1950? Yep, okay, right there, perfect. And also knows you didn't have an allergy ban. Do you have any allergies that I should be made aware of, maybe to chlorhexidine or tape? No? Okay. Well, earlier we took vital signs today, and they're at baseline, so you're fine, but right now it looks like your oxygen levels have depleted to 85%, which is below what we want. So before I begin, I realize that you're working to breathe a little. And do you have any shortness of breath? No? And how about pain? No pain? Okay. Alright, I'm just going to listen to your lungs. Just take a deep breath in for me, okay? And breathe out. Deep breath in and breathe out. Okay. Deep breath in and breathe out. Okay. Well, it sounds like you have some mucus buildup in the airways. We could actually get that fixed relatively easily. I'm just going to go in and suction that out for you. That shouldn't take too long. It's relatively painless, maybe a little uncomfortable. And after I'm done suctioning, I'm going to take out the inner cannula and replace it. And I'll clean your faceplate and get you a new dressing and a new necktie, alright? Perfect. Any questions before we start? No? Okay, good. So I'm going to move your head up to semi-Fowlers and close the curtains for privacy. I'm going to check my emergency supplies, okay? Okay, looks like the suction catheter is connected to the canister going at 120. Perfect. I will have to replace it though, it is used. The ambu bag is working at 100% oxygen with max flow rate, so that's good. O2 collar is connected to the humidifier. Perfect. We have 2 extra trachs, a smaller one just in case he needs it, and an extra inner cannula. Okay, give me 1 second, alright? Hand hygiene for 20 seconds. Okay, I'm just gonna wash the table now, alright? Washing the table for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay. Trash that. Hand hygiene for 20 seconds. Okay. And do you have any questions about the procedure? No? You worried about anything? No? Okay, that's good. Just hang in there with me for a bit. Sterile field. plastic side going on the patient and paper side up. Take out the sterile gloves. Place in the inner cannula. Perfect. Let's get rid of the old suction catheter. Okay. Looks like this is working at 120, which is as intended. Yep, still working. Okay. Sterile water going in from the side. Okay. Perfect. Hand hygiene for 20 seconds. Okay. So here's what I'm going to do next, okay? I'm going to hyper-oxygenate you. This is just so you have to feel your body a little more oxygen because I'm going to take off the oxygen collar while I work, alright? So all I need you to do is to just breathe normally for me, alright? Okay. 1 second. Okay. So just breathe normally for me when your bag is working. Okay, I'll put this over, right? Breathe in. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. Okay, and this is where I would check his oxygen levels. They're currently at 97%. If they were not, I would have to give more breaths until his oxygen levels have reached satisfactory levels. Right now you're at 97%, which is good. I'm just going to test the suction catheter, see if it's working. 120. Okay, just making sure. Suctioning, slurp, slurp, slurp. Looks like that'll work. Okay. So I'm just going to go in for 10 seconds. It'll only take 10 seconds. You might feel a little discomfort. But give me 1 second, alright? Bear with me here. Okay. Go in for 3 seconds. And then until he coughs. Patient has cough, cough, cough. Okay, I'm going to suction for 6 seconds, right? 1, 2, 3, 4, 5, 6, 7. Okay, perfect. So secretions have been collected on the canister. However, if the oxygen levels are still depleted, I would have to wait a minimum 30 seconds before going in again with the catheter. Okay. So how are you feeling? Is that good? Are you breathing? I've noticed that hand hygiene for 20 seconds. I've also noticed that your work of breathing is absent, and it looks like your oxygen levels are stabilizing, which is good. So how do you feel? Any pain? No? Comfortable to you? Okay, good. So next all I'm going to do is replace that inner cannula. Alright, give me 1 second. Okay, let me just take this off. Unclip. Toss in the trash. Okay, making sure to only touch the tip. Going in and clamping to make sure it stays. Taking off the dirty gauze. Reoxygenating. Okay, oxygen levels are still good. Perfect. I'm just going to prep the rest of my supplies. Split gauze. 1 dry gauze. And 3 wet gauzes. Perfect. And 2 wet cotton swabs. Okay. So I'm just going to go ahead and clean, alright? Okay. Site looks good, no redness. The trach itself needs to be clean, but otherwise no cracks. Okay, everything looks good. Swiping down the bottom. Okay. Swiping once on the top. That's good. Wet gauze. Okay. Wet gauze going on top. That's good. And wet gauze for the face plate. Perfect. Okay. Now I'm just gonna pat it dry. Pat. Pat. It is now dry. And I'm just gonna replace the split gauze. Okay. Okay, perfect. Just reoxygenate you. Okay, let me lay you down real quick. Okay, I'm actually gonna go ahead and head out and get another nurse. I can't replace your necktie by myself, so I'll be back in 5 minutes. Your call bell's to your right, and looks like your oxygen is still stable. And you don't have any work of breathing and any pain right now? No? Okay. So remember your call bell is on the right, lowest position, just in case. And I would note the trach too, and no signs of infection. Okay. So hand hygiene. Okay, I'm gonna be back. All right, I'm gonna get another nurse, and we'll finish the rest of it. All right. Thank you for holding. Both nurses come in wearing a face mask and face shield. Both nurses does 20 seconds of hygiene, and both nurses don gloves. Okay, hello, Mr. Smith. Before I start, let me just verify your identification. You John Smith, born on July 4th, 1950? Yes? Okay, thank you. Okay, perfect. Scan, and still no changes in allergies? Alright, good. Looks like your vital signs are still doing good, which is great. This is actually the second nurse, and they'll be here to help me change out your dressing, okay? So I'm just gonna move you to semi-phallus for a bit. Okay. So the second nurse would be on the left side. Okay. I'm gonna remove your oxygen collar, alright? Okay. So the nurse would be on the second side, holding down on the second nurse holds down the faceplate while I unbuckle, pushing down into the pillow and underneath the patient and checking for pressure sores. Oh, looks like you don't have any pressure sores on your neck. That's good. That's a good sign. Okay. While the second nurse is still holding on to the faceplate, I start to fasten the second trach tie. Okay. So fasten, and then second nurse still holding onto the faceplate while I push this down into the pillow and over on the other side. So you have no pressure sores here, which is good. I hold down the faceplate while the second nurse unfastens the original trach tie. Okay. And I'll discard of it. Second nurse would know if there are any pressure sores on the left side. I will hold on to the faceplate while the second nurse goes in and under. Okay, good. All right, perfect. All right, second nurse knows that there are no pressure sores on the left side. Take 2 fingers and check. Other nurse will check as well. Is that comfortable, Mr. Smith? Yeah? Okay. Is there any pain at all? No, it looks like your vitals are still good. Let me clean you up real quick. Let me get rid of this sterile field. I'm going to go ahead and listen to your lungs, all right? Okay. So same as last time, just breathe in and breathe out once my stethoscope's over. Breathe in and breathe in and out. Okay. So lung sounds are clear and bilateral, which is good. Your O2 stats are fine, which is reflected by the lung sound. So it looks like everything has been cleared up. Any pain? You feel any pain right now? No? Okay, well, thank you so much for cooperating with us. And thank you for the second nurse for helping me with the trach tie. And now I just clean up. Okay. Get rid of the sterile field along with everything else. Toss these. And then replace, leave a fresh mill catheter on this side while tossing out the old suction catheter for the next nurse to use. Okay, I'm gonna lay you back down flat, okay? Lay you back down flat. Okay, so any further questions before I leave? No? Okay, your call button's on the right, all right? And you're comfortable, correct? All right, thumbs up. Okay, perfect. Okay, so before I leave, I'll make sure to document the date and time, the site assessment, as well as the pressure sore or the absence of pressure sores on his neck, if the patient tolerated the procedure, vital signs, especially the O2 stat, the sputum color from the canister, as well as the amount, and the respiratory assessment. Okay, both nurses will remove gloves and do hand hygiene for 20 seconds before leaving.